We are basically having an interview with the student MCO. Yeah, the interview is basing on integration of the Buganda cultural practices and beliefs into the modern healthcare. So basically, on that topic of integration of Buganda cultural beliefs or the healthcare in the Buganda cultural beliefs and practices into the modern healthcare, it basically means combining the two, like incorporating the Buganda cultural practices into the modern healthcare practices. Basically, the tradition healing into the modern healing. It can be incorporated in any way. We have some traditional practices in the Buganda culture, some of which are emumbwa, which is sometimes used by the mothers that are yet to give birth.
Yeah.
So they use the mumbwa to ensure that they give birth easily without having any inconveniences or any issues.
Yeah.
So we have some other practices, but they are being used or being referred to with medicine, traditional medicine. So this kind of medicine that is used in the Buganda culture, we have what we call omululuza, that is sometimes used to heal malaria. We have bombo, we have kakubajiri, we have had very many. We have had kakubansiri, haijirikiti, kakubajiri, kakubansiri. Kakubansiri is used for malaria, basically. Yeah. So those are some of the traditional medicines. But now, what brings us here is to see on how we can incorporate those traditional medicines, traditional remedies, the traditional cultures, practices in the healthcare sector, and how we can incorporate them into the modern healthcare sector. And this incorporation, it has benefits, it has challenges, it also has risks, and many more other things connected to it. So with me, I have my interviewee called, she is Sonia Laureta Kayaga. Yes, I won't say much about her. She will tell us more, but she's a student MCO. She's ready to share with us. Since she has diverse connections and interactions with the community members in the Buganda culture, she has had interactions with traditional healers in the Buganda culture. She has also had more interaction with the healthcare professionals in the Buganda culture. And she's ready to share with us how we can incorporate. Yes, it is not yet into consideration as a country, but we can still share how we can incorporate the Buganda culture, healthcare, cultural, traditional medicines into the modern remedies. So, I think you are ready.
Yeah.
So can you tell us some of the ways traditional Buganda remedies could be used alongside the modern medicine?
So there are very many traditional practitioners in Buganda. There are bone setters, the traditional healers. The traditional healers are also known as herbalists. They're the ones that use herbs like plant parts like barks, leaves to make medicines out of them. Then there are also traditional birth attendants. So you've told me how to incorporate the traditional healers into the modern healthcare system. So we are trying to, as a country, the village health teams, also known as the VHPs. Yeah, since they are closer in the communities, they know the traditional healers in the community, the traditional birth attendants. So if the modern health systems, like the hospitals, are far from the community, the traditional health attendants or practitioners can help bridge a gap. Like if a mother is in labor and there's a traditional birth attendant close by, are you getting me?
Yes,
there's a traditional birth attendant close and the hospital is far. Why don't we use this traditional method and not help the mother deliver the baby instead of risking the baby's life and the mother's life by taking them to a far distance. Then also another way you can incorporate the traditional methods into the health sector. Like since you know the herbs, like some herbs are work on different diseases. So we know that this certain herb works on malaria. Why don't we put that particular herb in the pharmacy? Yeah, so that when somebody comes and prefers to use herbs other than a modern medicine, they can use the herbs. Yeah.
So people out there would like to know the challenges being faced by that can be faced by the modern healthcare professionals regarding this integration process in integrating the Buganda culture healthcare systems or the traditional systems in the Buganda culture, incorporating them into the modern healthcare systems. So what challenges may they face in case they decide to?
Okay. First and foremost, there's a propaganda that most traditional healers are witch doctors, which is not the case. So it will be so hard to help people or to make them understand that not all traditional healers are witch doctors. Then the traditional healers also have a problem on their part because there are very many traditional healers. There are very many different traditional medicines on the market, some of which don't work because they're made by quack people to get easy money. Then the traditional healers also don't have an association, like they're not organized. Anyone just comes up and decides to do one. Yeah. And also the traditional healers have, like all it is, they hate modern health workers because they believe that we envy culture. Like we see culture as a taboo or something like that, which is not the case.
I understand. What advice would you give to the modern healthcare professionals regarding the integration of the Buganda culture, healthcare practices and beliefs, integrating them into the modern healthcare? What advice would you give to those modern healthcare professionals?
So the modern healthcare professionals should reach out to the traditional healers. They shouldn't fear them or categorize them all as witch doctors. They have something that we don't, because we all believe that before modern medicine came about, people would still get sick, and these are the same people who used to treat them. Because the traditional health practitioners, they have this system of like their skills are inherited. Like it's generational. It's a generational thing. Like if my grandfather was a born setter, even the son, even the grandsons, because they would be seeing what their grandfather is doing, their grandfather would be guiding them to that path because that's their limited education. Like it's a generational education. So yeah, that's how they learn. But the other problem with them is that when they learn, they want to keep it to themselves. That's why. So the modern, they should teach us what they do so that we know the basis. Like they should have more clinical trials to see if the methods are really working.
So I want us to look at the ethical consideration part of it. With ethical considerations, we are mainly talking about the ethical implications. With ethical implications, there may be conflicts. There may be conflicts between the healthcare, the traditional healthcare providers and the modern healthcare providers. So I would like to pose a question. What are your thoughts on the potential for those conflicts between the Buganda cultural healthcare providers and the modern healthcare personnel?
So the first issue might arise whereby we have different causatives. Like my cause of the disease, like the modern medicine cause of the disease, might not be the same as the traditional practitioner. For example, mine would be like a disease, and the traditional practitioner might think it's spiritual. That's the first example of the ethical implication that can occur, because in science, like in modern science, we love to research and dig deep, but most of the traditional health practitioners see it from the surface, like the harmony, your spiritual well-being and all that. So that will be one of the problems. Then the second is the source of treatment. In modern science, my intervention to the particular disease might be a surgery, but then the traditional healer might have, let me say, a drug or herb or a certain practice. For example, smear this vaccine over and steam, yet it's something that needs surgery.
So according to you, how should these modern healthcare professionals or providers ensure that they are respecting the Buganda culture? As in, how should they ensure that they are respecting the health care in the Buganda culture? It can be the traditional healing, it can be the practices during the use of the medicine. So how can they ensure that they respect the Buganda culture in such an aspect of integration?
Okay, so I believe us as medics, we should focus mainly on culture sensitive care, like open communication. When somebody tells you that this is hard, how or what they want as a way forward for their disease, we should have an open view. Like we shouldn't only be focused on our scope of learning, but we should learn more. Like every person, every patient is a learning phase. Some patients, because first and foremost, healing starts from the mind. So if a patient's mind is not convinced with what you're giving them, they won't heal. So we should find ways of incorporating their beliefs into our medical system. For example, if somebody wants to steam, relieve from flu, allow them steam and give them the medicine you also believe would work for them. Yeah.
Oh, so basing on the ethical considerations, I think I've got something, and everyone there is getting something, and we are yet to understand on how we can incorporate these traditional practices into our modern healthcare system. So I would like to know, what are the potential risks that can arise? What are the potential risks that can arise in the integration of the Buganda healthcare culture and cultural practices and beliefs into the modern healthcare? What potential risks can arise?
Risks. Okay, now for example, like I said earlier, the traditional birth attendants. Okay, yes, the traditional birth attendants know what to do in delivery, in labor. They know what to do. But the problem with them is that they're not septic enough. Like they just use their plain hands and don't know if the mother is contaminated or infected and you're not, or if you're the one with a problem. So yeah, that can be a problem. So I think we should work hand in hand by ensuring that we show the traditional birth attendants what to do right. If you're going to help somebody give birth, at least wear gloves. You have to sterilize the environment before actually putting the mother there. Yes, when there are also efficacy concerns, like efficacy is how sure are we that the dog is going to work. Yeah. So that's also a concern. Like you can't be so sure. Like when is the dog going to work? What's the period the meat is going to work? What's the dosage? Yeah. That's also
So are there any benefits that we may encounter? Any benefits in case there is that integration of maybe the traditional medicines into the modern medicines, or the practices into the modern practices? Are there any medicines that may are there any benefits that we may encounter in such a manner?
Yes, first and foremost, it's cost effective because believe me, herbs are way cheaper than actual medicines. Yeah, because if you go to the herbalist and just tell them this is failing me and they have a herb, they won't charge you for consultation. Okay, they will charge you for consultation, but there will be no lab tests. Yeah, and also the herbs won't be as expensive as the medicines that you have. Yeah. Then another advantage is that remember these traditional health practitioners are in the community. So being in the community, people already have belief in them. So, and as I said earlier, healing starts from the mind. So if everybody has gone there, like your family, your aunt, your mom has gone there and undergo heals, so of course when you go there, you will know deep down inside you that you're going to heal no matter what. So yeah. Then also, yeah, as I said, they're close to the people. So it will be close by. So reduce death rates of pregnant mothers and other cohorts sick. Yeah. Because the health care is much closer to them. Yeah.
So someone can easily plant a traditional medicine at their home.
Exactly. So it will be like if you feel like fever, you should just take some. Making it cost effective and easy to access.
What about a mombwa? Is it planted?
It is not planted, but as I said, these traditional healers are close by the community, so it won't be out of reach. It's closer to you. It's much closer to you.
Okay. So, can you share with us something personal? As in, you are now a student, MCO. I would like to know, or anyone else would like to know, you have been exploring a lot, yes. So as this exploration of Buganda, basically on the integration of the Buganda cultural practices in the healthcare sector, then integrating it into the modern healthcare. So how is it influencing your future?
So basically, after interacting with traditional healers and the community and the medical system, I personally have got a deeper understanding of the traditional aspects of life and the medical aspects of life. And yes, to be true, like they both work. Because, like, for example, let's say Japan. In Japan, most of their pharmacies have the local part, like a side of the local medicines, then the side of the modern medicines. So we have to, because they both work, yes. So it depends on somebody's cultural belief and what they want. So yeah, I think we should prioritize culture sensitive care and incorporate more of the traditional methods that are not rigid, but are solid, by making more clinical trials to find out which works better, how it works, making more research, and also encouraging the traditional practitioners to research and document their works, because the biggest challenge we are facing is that their works are not documented anywhere. Like, they're not documented anywhere. They don't have right dosages. They don't have the formulae. It's just what they think. I don't know, like what they think at that particular moment. So if you don't have the documentation, like where else would somebody know what will heal them if you're the only person with the information? But if you're not there, what can they do? So yeah, they should document their works so that the outside world also gets to know what is really happening.
So basically, our interview today, it has been mainly about, yes, integrating the Buganda cultural practices, basically in the healthcare sector. We are seeing that they can be integrated, or they can be incorporated into the modern healthcare. And with this integration, we can have different benefits. Of course, challenges also there are in, and potential risks can also arise. Yes. So basically, this interview is an eye-opener to the healthcare professionals in our country, Uganda. Since we are dealing with the Buganda culture today, there are also other cultures.
Yes.
Besides the Buganda culture, we have other cultures. So they can also bring in their practices regarding the health sector and incorporate them into the modern health care. As you said before, you talked of a person going to the hospital, and there is a conflict between the modern health care provider and the traditional healer. So with the modern healthcare provider, say it a doctor, the guy may say, okay, he may diagnose a patient and treat that patient differently. And when that same patient goes to the traditional healer, and the traditional healer will also diagnose different sicknesses and also give a very different treatment compared to that of the doctor, and therefore there will be a certain conflict. So to avoid all those conflicts, there should be an integration. Of the practices in the culture and then the practices in the modern healthcare sector. So with that incorporation and with that combination, we can have effectiveness, and it will strengthen the health sector in the government of Uganda, or in the Uganda as a country. So we shall see effectiveness of the medicine that is being produced in the country Uganda, and there will be limited use of herbal medicines that may not actually work. But here, herbal medicines are being developed. There is an increment on the way they are effective to the patients. So that is what our interview has been about mainly.
Yes. The government should bring policies to incorporate the use of traditional medicines but the policies should mainly tell the traditional practitioners to have an organized association and to document and make research about their medicines by making more clinical trials, and also the community and the traditional healers and the modern health professionals should have interactions to say what suits best, what works best here. Yeah.
So our end question will be, in case the government, yes, brings in those policies, where do you see our Uganda?
Our Uganda, I see a very bright future for it, because it will be harmonious for the people who believe in the traditional medicines and the people who believe in the modern medicines. They will all have where to be. They will all have where they belong. Yeah, because if you want to use the traditional medicines, you can use them, and it will be better for you to use them because they will now have a signified dosage, signified, like they will be clear for usage. They won't affect your kidney. They will be good to use. Then the modern, people who believe in the modern, they are modern.
Oh, so with the integration of the Uganda healthcare cultural practices and beliefs into the modern healthcare in the country Uganda, we shall be able to have hospitals or the health sector with effective systems, with more effective systems. Yes, the current ones are effective, but there will be a degree of effectiveness being added on. So I remain Chiwewa Aloysius. I'm the interviewer for today, and I have been interviewing Sonia Laureta Kayaga, a student MCO.